We're told that dentists could be paid up to £20,000 to move to areas where there's a shortage of NHS dentistry under new plans unveiled by the government. But is it going to be enough? I'm asking you today. Do get in touch. 0344 499 1000 is the number to call with your, well, trials and tribulations of getting an NHS dentist. We just heard from someone saying, Luke in Bromley saying, no, it's no problem at all getting an NHS dentist. I've had other people tweeting me saying, haven't been able to find an NHS dentist in years. Do get in touch. Give us a call on the phones. Joining right now to discuss this is the chair of the British Dental Association, Eddie Crouch. Good morning to you, Eddie.
Good morning, Julia.
Thanks for joining us. First of all, before we talk about what the government's going to do, what is the problem? Why is it that people can't join an NHS dentist? And given the stats, I mean, some extraordinary stats revealed last year that 8 in 10 NHS practices are not taking on children. A third of the UK's council areas have no dentists taking on adult NHS patients. I mean, 9 in 10 NHS dental practices are not accepting new dental patients for treatment under the NHS. I mean, what is going on? How has this come about?
Well, I mean, last year we had a Health Select Committee inquiry into NHS dentistry. They came out with a report. We had a Nuffield Trust assessment of NHS dentistry. They came out with virtually the same sort of conclusion. But sadly, we've got a minister who hasn't listened to those conclusions. It's the same conclusion that the British Dental Association have made, that this contract is not fit for purpose.
No, so that's it. I just want to, Eddie, let me clarify. So we're in that situation. No one thinks that that's not true. Those figures are true. So why are we in that situation? You're saying it's the NHS dental contract. What does that contract do? Is this the 2006 one? This contract?
Yeah, absolutely.
What does it do that means that dentists go, sod this for a game of soldiers, I'm going to do private practice only?
Well, it hasn't properly been amended to actually make it acceptable for people to want to work in it, for one thing. So we've got a workforce and a recruitment problem. So many of my colleagues who've got NHS dental contracts are not able to deliver that because they can't get the workforce to come and work to that contract. And as a consequence of that, at the end of the financial year, they hand back money to the NHS, and last year it was £460 million. So when we're talking about 200 million, and I know it's not new money, and you said that earlier on, that isn't really going to solve the problem.
It doesn't really touch the sides of it. So here's the deal. So you've got a lot of people who've trained to be dentists, and there's a lot of training, expensive training, and then they go to the... And what I've been hearing from some NHS dentists is that, you know, even if you do some NHS work, you might not actually be reimbursed by the NHS for all of that work. You can be out of pocket. You can earn far more doing private work, and it's just not worth their while. They just won't do it. They can fill up their time all day with private care, so they don't do NHS care, which of course makes the private care even more lucrative because people don't have a choice and there's more and more people needing private health care. Is the solution then very simple? We need to pay dentists pay them more to do NHS care?
No, that isn't the simple solution. No, as I say, we need a contractual framework that actually allows dentists to deliver appropriate care to their patients.
What does that mean, Eddie?
What does that mean? It means that what we would want is a capitation service where an allocation of funding is given to the dental practice based on the type of patients that practice is seeing, so that they can provide a course of treatment to those patients over a long period of time that will make them dentally fit. What we've got at the moment is a target-driven system, and it would have fallen apart a long time ago had it not been for the charitable work of dentists who are actually doing NHS treatment for a loss. It's a business loss to the practice,
and they shouldn't have to do that.
Destabilising.
While you were talking, we were just showing images of this cube in Bristol. It was a couple of years ago where people there was a new NHS dentist open. We're taking on new people, and there were queues round the block for 2 days. People were that desperate. We know stories of people certainly unable to access any NHS dental care in 2020 and 2021 when basically locked down and decided the NHS in all its forms was only available to people with COVID. People pulling their own teeth. I mean, this is horrific. And we know that regular checkups, I mean, when I was a kid, it was every 6 months. Nothing to discuss. Everyone went to the dentist every 6 months. I've never understood why we've decided at some point, I don't know who did this, that eyes and teeth weren't part of our bodies and they weren't covered by the NHS automatically.
Yeah, I mean, it really is quite shocking, and I honestly believe that if in my own city of Birmingham that we had a new practice opening up, we would probably see the same things, and it's shocking. You know, we should have a service that's available there for the whole of the population. But what we've had is a complete lack of interest in NHS dentistry. It's been the Cinderella service of the NHS, one area of the NHS that's actually seen a net reduction in funding. So in real terms, we're about £1 billion down on what we were 10 years ago. And that underinvestment now is coming home to roost.
So a new contract which encourages, more sort of proactive, obviously preventative care, more checkups, perhaps rather than the
Absolutely.
targets, paying dentists more for doing that. So something equivalent to where they could be getting in the private sector. That's what we're going to have to do to get these dentists to work. And that would actually probably end up saving the NHS more money in the long term, wouldn't it? Because we know that, poor teeth, poor dental care, it can often be an indication of other poor healthcare. We know that the biggest reason why children aged, 6 to 12 end up in hospital is for general anaesthetic to have their teeth pulled out, because that's not, general anaesthetic is not allowed in dental surgeries anymore. So we could end up actually saving money by saving the nation's teeth.
Yeah, I mean, if we were allowed to provide preventative care, and this contract doesn't allow us to do that and be remunerated for it, you're absolutely right. We could save a huge amount of money. You know, every single person that turns up at A&E with a dental problem costs the NHS about £400, and that
Yeah.
money invested into primary care for prevention would eventually save the NHS a lot of money. But the sad thing is, it's never done in the cycle of a government. You know, they need to see a return in their 5 years of being a ruling government, and that they're not going to see it in the short term. It's a
Okay.
longer term
Yeah,
investment.
but that's the thing, isn't it? It really is. Thank you so much. Really good to talk to you, Eddie Crouch, Chair of the British Dental
Thank you.
Association.